Yeah.
I would no. Well, probably the easiest way to answer that question is in the last 5 years, junior doctors have, in real terms, had their pay cut by 15%. And we haven't been out on the streets, withdrawing our services. The reason we're striking is because we believe this contract is going to undermine our ability to deliver safe patient care.
In what way?
Well, so the main problem is that this contract is justified by Jeremy Hunt as a means to deliver a 7-day NHS.
Yeah.
So the 5-day elective NHS we have is already struggling. The 7-day emergency NHS we already have is struggling. So how is he going to provide a 7-day elective NHS without any extra money? It just doesn't make sense.
No.
It's going to mean spreading us, the junior doctor workforce, and as soon as he starts spreading us, he's going to spread every other healthcare professional more thinly across the 7 days. And bigger gaps, more dangerous gaps are going to begin to emerge. So that's our real concern, that this is a contract that is going to take us down a working pattern that is just simply not sustainable. The Saturday working is part of that, because in protecting our weekend working, we stop ourselves being spread over 7 days. I've just finished an A&E rota, and I was working 3 weekends in 4. So it's very easy with the existing contract to have us working at weekends. But what he's trying to do is spread us more thinly by changing our contract.
But they're also saying that the new arrangements will mean that you can't be made to work so many hours, which obviously is a good thing.
In principle, but there's absolutely no safeguard within the new contract to stop that from happening. So that what they're proposing is that each hospital has to create an entirely new, completely fragmented from every other hospital system of protecting the working conditions of junior doctors. It simply won't work. It lacks any sort of robust teeth to offer us protection. So we would be in a system where they would say, well, on paper you can't work more than 56 hours, which is less than the 70 hours you were working. But the reality would be we would have no recourse if we found ourselves being overworked. And the thing about junior doctors and the thing about other healthcare professionals is we don't clock off at 5 o'clock. We stay until the job's done, because you have to. You can't look someone in the eye and say, actually, I'm finishing now. Just like what happened today, I had an important engagement I had to be to. There was an unwell patient on the ward, and I couldn't walk away until I'd finished doing that job. And so we're bound by that duty of care. It's not only a moral, ethical duty of care, it's a professional duty of care. We're bound by a professional body that has those expectations that we regularly go beyond the call of duty. So it's a very, very concerning contract for many reasons, but the reason we're withdrawing our labour, the reason why we're not going to work tomorrow and taking this unprecedented action is because we're worried about the care we'll be able to give this time next year when we're all working under that contract, and we're all spread too thinly with inadequate safeguards and not